In this video we are going to talk about the diagnostic criteria of diabetes, so let's start. The Expert Committee of the American Diabetes Association has established the diagnostic criteria for diabetes for non-pregnant individuals of any age. For those individuals, a diagnosis of diabetes can be made when one of the following is present. The criteria number 1 is an A1C of 6.5% or more. The test must be performed in a laboratory, not with a point-of-care test. It should be performed using a method certified by the National Glycohemoglobin Standardization Program. Criteria 2 is an FPG, which is fasting plasma glucose of 126 mg per deciliter or more. It should be kept in mind that fasting means no caloric intake for at least 8 hours. Criteria 3. When classic signs and symptoms of diabetes, polyuria, which means if someone urinate more than normal, polydipsia, which is feeling of extreme thirstiness. Ketonuria, means high ketone levels in urine. An unexplained weight loss, are present combined with a random plasma glucose of 200 mg per deciliter or more. Criteria 4 is when after a standard oral glucose tolerance test OGTT, 75 grams of glucose for an adult, or 1.75 grams per kilogram for a child, the venous plasma glucose concentration is 200 mg per deciliter or more at 2 hours. To stay up to date, make sure to subscribe to our channel for more informative videos. Thanks for watching.